Okay, all of you, very good evening, very good evening. It's after a long time I'm again back on to this virtual platform. It's me, Abhilash Vijayamohanan Nair, again on B-GHUD OET classes. Hope all are doing good and fine. അപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നെന്ന് വിചാരിക്കുന്നു, സമാധാനമായിട്ടിരിക്കുന്നെന്ന് വിചാരിക്കുന്നു. എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നോ? അപ്പോൾ എന്തൊക്കെയുണ്ട് വിശേഷം? നമ്മൾ 1-2 ആഴ്ചയായി ലൈവ് പോയിട്ട്. So, കുറച്ച് inconvenience ഉണ്ടായിരുന്നു. So, I am asking an excuse, sorry to all of you that we have got certain sessions missed. അപ്പോൾ നമ്മുടെ കഴിഞ്ഞ കുറച്ച് സെഷൻസ് മിസ്സായത് കാരണം ഞാൻ എല്ലാവരോടും ഒരു സോറി ചോദിക്കുന്നു. അപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു എന്ന് വിചാരിക്കുന്നു. Who are there on online platform? I think it is very less. Bonnie, hello Bonnie, how are you? Good evening Bonnie. അപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നെന്ന് വിചാരിക്കുന്നു. സോ വിൽ സ്റ്റാർട്ട് ടുഡേയ്സ് സെഷൻ. അപ്പോൾ നമുക്ക് ഇന്നത്തെ സെഷനുമായിട്ട് മുമ്പോട്ട് പോകാം. സോ യു കുഡ് സെൻഡ് മീ യുവർ സജഷൻസ്, യുവർ ഫീഡ്ബാക്സ്, യുവർ കമൻറ്റ്സ്, യുവർ കൺസേൺസ്, ക്വയറീസ് ഓൺ OET സ്പീക്കിംഗ്. OET സ്പീക്കിങ്ങിനെ കുറിച്ച് നിങ്ങൾക്കുണ്ടാകുന്ന ക്വയറീസും കൺസേൺസും ക്വസ്റ്റ്യൻസും ഒക്കെ നമുക്കിവിടെ ചോദിക്കാം. നമ്മുടെ സ്റ്റുഡൻസ് അയച്ചു തരുന്ന ഫീഡ്ബാക്കുകൾക്ക് അനുസരിച്ച് തന്നെ നമ്മൾ ക്ലാസ് എടുക്കാറുണ്ട്. സോ വിൽ ബി ടേക്കിംഗ് ഡിഫറെൻറ്റ് യുണീക്ക് ടോപ്പിക്സ്. ഓക്കെ, ഡിഫറെൻറ്റ് ടോപ്പിക്സ്, യുണീക്ക് ആയിട്ടുള്ള ടോപ്പിക്സാണ് സോഫാർ എടുത്ത് നമ്മുടെ 11th OET സ്പീക്കിംഗ് സെഷനാണ് പോകുന്നത് വെർച്വൽ പ്ലാറ്റ്ഫോം ഓൺലൈനിൽ. അപ്പോൾ എല്ലാവരും ക്ലാസ് കേൾക്കുക. ഐ വോണ്ട് ഓൾ ഓഫ് യു ടു ലിസൺ ടു ദിസ് വെർച്വൽ പ്ലാറ്റ്ഫോം ക്ലാസ്സസ്. മേക്ക് യൂസ് ഓഫ് ഇറ്റ് ആൻഡ് ഡു ഷെയർ ഇറ്റ് എമോങ് ദോസ് ഹു ആർ നീഡി. ഓക്കെ, ക്ലാസ് ആവശ്യമുണ്ട് എന്ന് തോന്നുന്ന കുട്ടികൾക്കായിട്ട് നിങ്ങളിത് ഷെയർ ചെയ്യുക. അപ്പോൾ അതുപോലെ തന്നെ ട്രൈ ടു ഗീവ് കമൻറ്റ്സ്, ട്രൈ ടു ലൈക്ക്, ട്രൈ ടു ഷെയർ ആൻഡ് മേക്ക് യൂസ് ഓഫ് ദിസ് സെഷൻസ്. ഓക്കെ, അപ്പോൾ എല്ലാവരും നമ്മുടെ സെഷൻസ് മാക്സിമം യൂട്ടിലൈസ് ചെയ്യുക. ആൻഡ് ഐ വോണ്ട് ഓൾ ഓഫ് യു ടു ഫെച്ച് എ വെരി ഗുഡ് സ്കോർ ആൻഡ് ബൈ നെക്സ്റ്റ് ഇയർ ദിസ് ടൈം മേ ഗോഡ് ദ ഓൾമൈറ്റി ഷവർ ഹിസ് ബ്ലെസ്സിങ്സ് അപ്പോൺ യു ഓൾ to reach your dream destinations, to fly into weathering heights with multicolors. ഓക്കെ, അപ്പോൾ ഭഗവാന്റെ അനുഗ്രഹം കൊണ്ട് നല്ല സ്കോർ വാങ്ങിച്ച് എല്ലാവരും നല്ല രീതിയിൽ തന്നെ പോവുക. സോ നമുക്ക് നല്ല നല്ല റിസൾട്ട്സ് വന്നുകൊണ്ടിരിക്കുന്നു. ഐ എം വെരി ഹാപ്പി ദാറ്റ് ഓൾ അവർ സ്റ്റുഡൻസ് ആർ ഗെറ്റിംഗ് സച്ച് ആൻ അമേസിംഗ് റിസൾട്ട്സ്. വി ആർ ബ്ലെസ്ഡ് വിത്ത് റിസൾട്ട്സ് ഇൻ അബൻഡൻസ്. ഓക്കെ, ധാരാളമായിട്ട് തന്നെ നമുക്ക് നല്ല പാസ് പെർസെൻറ്റേജും സ്പീക്കിങ്ങിനൊക്കെ നല്ല സ്കോറും വന്നുകൊണ്ടിരിക്കുന്നു. സോ സൂൺ ദേ വിൽ ബി ഡിസ്പ്ലേയിങ് ദ റിസൾട്ട്സ് ഓൺ യുവർ മീഡിയ പ്ലാറ്റ്ഫോംസ്. ഓക്കെ, മീഡിയ പ്ലാറ്റ്ഫോമിൽ സൂൺ തന്നെ നമുക്ക് റിസൾട്ട്സ് എല്ലാം വന്നുകൊണ്ടിരിക്കുന്നതായിരിക്കും. യെസ്, ടെൻസി മനെ, ഹലോ രമ്യ, ഹലോ ഓൾ ഓഫ് യു. സോ നിങ്ങൾക്ക് നിങ്ങളുടെ കൺസേൺസും ക്വയറീസും ഒക്കെ അയച്ചു തരാം. രമ്യ, താങ്ക് യു, നൈസ് ക്ലാസ്. നമ്മൾ തുടങ്ങിയിട്ടേ ഉള്ളൂ, അപ്പോഴത്തേക്ക് എന്നെ അപ്രീഷിയേറ്റ് ചെയ്ത് നിങ്ങളെല്ലാവരും എന്നെ ഭയങ്കരമായിട്ട് എൻകറേജ് ചെയ്യുന്നു. ഐ എം വെരി ഹാപ്പി മനെ രമ്യ ഫോർ യുവർ വാല്യുബിൾ ഫീഡ്ബാക്ക്. ടെൻസി, ഹലോ മനെ. യെസ്, സോ അപ്പോൾ നമ്മൾ ഇനിയും അങ്ങനെ ഡിലേ ഒന്നും ആവുന്നില്ല. അപ്പോൾ ഇന്നിപ്പം നമുക്കൊരു ക്വസ്റ്റ്യൻ വന്നിട്ടുണ്ട്, സർ എംപത്തറ്റിക് ഫ്രേസുകൾ ഒന്ന് പറഞ്ഞു തരാമോ എന്ന് നമുക്ക് ഒരു ഇത് വന്നിട്ടുണ്ട്. എംപത്തറ്റിക് ഫ്രേസസ് ഐ ഹാവ് ഓൾറെഡി ഡിസ്കസ്ഡ് ആൻഡ് ഓൾസോ ഇറ്റ്സ് following the request of our students, we will be discussing those things again. Okay, so if you want more clarifications, if you want more details or notes for that, you could refer to our previous classes and all. Detailed description of all those notes has been all those notes have been there, so you can go through that. Okay, അപ്പോൾ നിങ്ങൾക്ക് വേണമെന്നുണ്ടെങ്കിൽ പഴയ സെഷൻസ് ഒക്കെ എടുത്ത് നോക്കാം. അപ്പോൾ ഇന്ന് നമ്മളോട് പറഞ്ഞിരിക്കുന്നത് എംപത്തറ്റിക് ഫ്രേസസിനെ കുറിച്ചിട്ടൊന്ന് പറയാവുന്ന. എംപത്തറ്റിക് ഫ്രേസസ് നിങ്ങൾക്ക് ആർക്കെങ്കിലും കമൻറ്റ് ചെയ്യാൻ പറ്റുന്നെങ്കിൽ you can comment it here. Okay, those who are willing to contribute. So let it be an interactive class. Even though this is a virtual platform class, let it be an interactive class. You people are free to send your comments. Okay, those who have got any points means please do pin it as a comment. You can give good morning Mane. Actually Rini, is this good morning? I received a good score in speaking. I marked all your valuable points in my notes. It was so helpful for me. Thank you very much Mane. Rini, I'm very happy. Thank you for your valuable suggestions and valuable comments on me. I'm very happy. It's not only because of me, it is because of B-GHUD. All our faculty from different departments have contributed in your results. I'm very happy that you just pointed out my name. So do remember me in your prayers. Do remember B-GHUD in your prayers. Okay, all the very best for your future endeavors. മക്കളെ നന്നായി വരട്ടെ, ഒത്തിരി സന്തോഷം. Okay, so pin your suggestions over the comment box. You can send your feedbacks, valuable suggestions and all. It is always appreciated. We always appreciate your comments, your suggestions and all, because our students are our backbone, our strength. Okay, നിങ്ങളുടെ സ്റ്റുഡൻസ് ഇല്ലാതെ നമുക്കൊരു എക്സിസ്റ്റൻസ് ഇല്ല. അപ്പോൾ നിങ്ങൾക്ക് എന്ത് രീതിയിൽ വേണമെങ്കിലും നമ്മളോട് നിങ്ങളുടെ സജഷൻസും ക്വയറീസും കൺസേൺസും ഒക്കെ പിൻ ചെയ്ത് പോയിൻ്റ് ഔട്ട് ചെയ്യാൻ പറ്റുന്നതാണ്. ഓക്കെ, റിനി മോളെ, ഗോഡ് ബ്ലെസ് യു. യെസ്, ഇപ്പം നമുക്കൊരു എ ബാൻഡ് വന്നിട്ടുണ്ട്. നമുക്കൊരു എ ബാൻഡ് ഇത്തവണ സ്പീക്കിങ്ങിന് വന്നിട്ടുണ്ട്. സോ ദ ഡീറ്റെയിൽസ് വിൽ ബി ഡിസ്പ്ലേ ഇൻ ദ മീഡിയ. ഐ എം വെരി ഹാപ്പി ദറ്റ് വി ആർ റിസീവിംഗ് ഗുഡ് റിസൾട്ട്. എ ബാൻഡ് ഇൻ സ്പീക്കിംഗ് ഈസ് എ വെരി ഗുഡ് തിങ്. ഇറ്റ് ഈസ് വെരി tough to imagine an A band, okay, S band score in OET speaking. So we are blessed with that. More details will be uploaded. So we are getting അതിൻ്റെ ഒരു കൺഫർമേഷൻ വന്നിട്ട് ഞാനത് പറയാമെന്ന് വിചാരിച്ചു. എന്നാലും നമുക്കൊരു സന്തോഷമായിട്ടുള്ളൊരു വാർത്തയാണ്. The student will be introduced soon. So I'm very happy that all my dear students are working also. Along with our classes, they are also working. It is because of their wisdom. I could say that. I should say that. Okay, it is because of their wisdom, their hard work, their blessings, God's grace and all. They are all, and perseverance of us is also there. I am very happy. They are joining their hands. My students are joining their hands with us so that they are getting blessed with such a very good amazing results. Okay, so അപ്പോൾ നമുക്ക് എന്തൊക്കെയാണ് നമ്മുടെ എംപത്തൈസിങ് ഫ്രേസസ് എന്തൊക്കെയാണെന്നുള്ളത് നോക്കാം. എന്തൊക്കെയാണ് നമ്മുടെ എംപത്തൈസിങ് ഫ്രേസസ്? Can anyone contribute? So the universal empathetic phrase is like I'm sorry. Okay, that we are cracking is I'm sorry. Yes. No one is giving me any feedback. I'm sorry. Then what you can say, like I understand. I understand. I can understand. I'm sorry. Okay, I'm afraid, you can say, instead of I'm sorry, you can say like I'm afraid. Okay, never use any prepositions after afraid, so the meaning will be changing entirely. Okay, never use I'm afraid to tell you. Never speak that I'm afraid to tell you on behalf of sorry, because it doesn't mean that it doesn't mean sorry. It changes its meanings to that we are afraid to tell that particular thing. If you want to say something, if you want to say I'm afraid on behalf of I'm sorry, you have to say like I'm afraid, I cannot tell you that for sure. Okay, I'm sorry, I cannot, I'm afraid, I cannot tell you. Yes, if you're speaking in that terms, that definitely, obviously that means like you are sorry to tell that. Okay, you can say like I'm sorry to tell you, but never say I'm afraid to tell you. No, if you want to say I'm afraid on behalf of I'm sorry, just say I'm afraid, I can't tell you. Okay, so that is what you have to speak out. Okay, see, yes, I'm sorry, I'm afraid, I understand, I can understand, I know how you must feel. I know how you must feel. Okay, I sense this must have been hard for you. I can sense. Okay, I can understand. I understand. Okay, I appreciate your feels. Okay, I respect your says. I value your says. I value your feelings. I value your emotions. Whatever it is, you can speak like that. I know this must have been hard for you. I know this must have been hard for you. Okay, that sounds really hard. That sounds really tough. Okay, that's very hard to cope. It is hard to cope. Okay, so these are some empathetic phrases that you can use when your speaking session is progressing. Okay, whenever some discussion is going on, if you want to state some empathetic phrases, see, for more details and all, you can refer to our previous notes, previous classes, and it's all been discussed there. And you can say it's okay, it's okay, it's okay, it's okay. Okay, it's okay, you can say like that. Try not to worry, don't worry, don't worry, try not to worry. All these things can also be used as empathetic phrases for your discussions. Okay, yes, all my dear students, hope all are following me, hope all are there with me, hope you all are getting me what I am saying. Okay, so if you have got any more queries or concerns, you can definitely pin your suggestions, you can definitely add your comments or suggestions. Okay, fine. Yes, so I think this is the only thing that my students have asked me to discuss. Okay, So, I can ask you to, okay, I could now offer you some sentences on summarizing or checking understanding, how to, what are all some sentence question structures that could be used for summarizing or check for understanding whether the okay, this is during that conclusion, okay, while this conclusion portion is there, okay, whenever you are going for concluding that statement or the speaking session, you can check for their understanding, or you can check for their, this can be used for summarizing, okay, or you can check for understanding, that we are confirming with the patient whether they have got all the points that we have discussed, okay. So, you can make use of this. Can anyone just comment some summarizing statements or check for understanding statements? Any of my students, if you are just contributing at least one sentence, I would be really happy. I feel like you people are interacting with me. This is a joint venture, I feel like that. So, please make sure that someone is at least just commenting me any summarizing statement or any check for understanding statements that is there in your mind. Even if it is wrong, that does not matter, okay. Please join in this session, okay, so that it will be more interactive. Yes, no one is there. Tensi, Remya, Rini, Bonnie, anyone can comment? Yes. Okay, so nobody is ready to display their comments. Okay, so what we can say, like, okay, I hope you are clear. I hope you are clear. So, that is, I hope you are clear. I hope you are following. Are you getting me? I hope you are clear. I hope you are getting me. I hope, okay, are you getting me? Okay, then does that make sense? Okay, does that make sense? Does that make sense? Have I made everything clear? Have I made everything clear? Have I made everything clear? Then what else is there? Yes. Is there anything else that you would like to ask? Is there anything else that you would like to ask? Is there anything else that you would like to ask? Yes. And is there anything else? Is there anything that is bothering you? Is there anything that is bothering you? Okay. Okay. Is there anything that you don't understand? Is there anything that you don't understand? Okay. Is there anything that you don't understand? Yes. Okay. Let us go through that again. Let us go through that again. Let us go through that again. Yes. Okay. Then what else you can say? Do you have any queries for me? Do you have any other questions? Okay. Is there anything else that is bothering you? Okay, these are certain statements, that is check for understanding, or some key phrases that you can go for, and checking the understanding of the patient, or for summarizing you can do this. Okay, is there anything? Oh, Bibin Umman Tamarevil. Okay, Bibin, I am very happy that you are the first one who is commenting me with this. So, if you have got more, is there anything else bothering you? Yes, that's correct. Okay, let me repeat that. You can ask like, let me repeat that. Let me repeat that. Okay, let me repeat that. So, these are certain statements, okay, that you can go that you can try. You can try in your speaking session to check their understanding, or as a summarizing statements you can do this. Okay. So, hope these both sessions are clear. So, I have just given you empathizing statements and also summarizing check for understanding statements. Hope these things are clear to one and all. Yes. Yes, my dear students. Okay. So, now I think this is clear to all. So, now we will be moving towards question discussion. We will be having our role play for today. So, let us go through the question. Am I clear to you? Have I made everything clear? Yes, Safna. It's quite late. Then also I am very happy that you people are just following me. Thank you, Maklaim. Thank you all for giving me good giving me this suggestion. So you people are just contributing your statements with me. I am very happy, all my dear students. Okay, so the question is displayed right there. You can go through that. Okay, so the empathizing statements we have just gone through once more. We have just brushed up those empathizing statements, though already we have discussed that, because as per the request of the students we are just giving that statements again, and summarizing check for understanding statements also we have just discussed. Okay. Yes. So now I am giving you the question is there, you can go through that, all of you just have a quick look, okay. Just go through that, after a few minutes I will be discussing this questions, you can go through that. Yes, please go through those questions. I am very happy that my dear Bibin Umman, I passed my OET last July and I got 420 in speaking, only because of you. I still like to hear from you. Thank you, sir. Bibin, I am very happy that you people are again watching me, again you people are listening to me. Thank you for this good comments and thank you for making my session more valuable and more memorable through your presence. 420 is a great score. My heartfelt prayers to my dear Bibin and my dear Rini, all my dear students, those who have passed with such a great good score. See, my eyes now, it's just welled up with tears. I feel like, yes, yes, Bibin, I am getting you. I am getting you. Man, I am from you are from my place, Chettivalangara. I remember you. Okay, I am very happy. So my place, I'm very happy that we both are from same place. Thank you, Bibin. Thank you for again coming and joining in this session. And I'm more blessed because you people are blessing me with your comments. Okay, all my prayers and wishes for you, Mane. Okay. You are from Iredathek, right, Bibin? Yes, Bibin. Am I correct? Ah, okay. Yes. Very happy, Mane. Very happy that you are just joining once again to the sessions. Okay, now anyway, today is a very good special day for me that all my dear students are coming and my students are informing me with their results. Okay, so yes, we will go for question discussions. Yes, yes, yes. Once we met in B-GHUD classroom in MAVELIKARA. Yes, Maklai, I'm happy. Thank you, Bibin. Very happy that you are in UK. You got safely placed, well settled. May God bless you. Okay. അടുത്ത ഭരണിക്ക് വരണം കാണണം ഓക്കെ ബിബിനെ വിളിക്കുക കോണ്ടാക്ട് ചെയ്യുക കാണുക സോ ഐ വിൽ ബി മോർ ഹാപ്പി യെസ് okay so we'll go for question discussion my dear students yes so setting is a hospital ward. You see a 32-year-old patient who was admitted overnight for monitoring following arrival with chest pain and dizziness yesterday. All tests have proved negative but is still being monitored by ECG, electrocardiogram. Okay. You have come to do clinical observation. Yes. Find out if the patient had a comfortable night. Yes. So, my dear students, this one is a hospital ward case, an admitted case. Yes. The patient was there for monitoring since yesterday. Overnight monitoring means the patient has been continuously in the observation unit. Overnight the patient was there inside the unit. Okay, so this is a known case, an admitted case. Overnight monitoring was there for the patient. The patient has been there in the unit for overnight monitoring. So we can take it as a known case. Overnight monitoring, you have to focus on that. following arrival with the chest pain, dizziness yesterday. So, the patient complaints were dizziness and chest pain. All tests have proved negative. Okay, almost all the tests were showing normal results, but still being monitored by ECG, but the patient is still under ECG monitoring. You have come to do clinical observation. So, our task now is to do clinical observation. So, during our clinical observation, we are going to have a chat with this patient. Known case, overnight monitoring was there. The patient is here for overnight monitoring, still being monitored by ECG, monitored through ECG. All other tests have proved normal. Okay, were negative in the sense all those tests were normal. So, now we are here to for our clinical checks, and we are seeing how this patient is feeling. So, it is a known case, the gender is not mentioned he or she. So, depending upon the gender of examiner, you can consider the examiner and can take the case, okay, and can consider the case. Find out if the patient had a comfortable night. So, we need to ask whether the patient had a comfortable night, in the sense the patient was not enjoying the patient, we need to ask about the sleep, that is what. So, beginning introduction, we know we can collect the name during our preparation time of 3 minutes, we can collect the name. As a known case, we can start this topic, we can continue this topic, okay. Yes. Yes, find out if the patient had a comfortable night. We need to ask whether the patient's about the patient's sleep. Okay, comfortable night. So, give reasons for patient being woken up early. Obviously, you can expect some sort of argument from the patient because being woken up early in the morning. This is not the usual bedtime of that patient. Definitely, you can expect a hangama from the patient because it's early morning 6 a.m. We have just made the patient out of his sleep. Find out if the patient's symptoms are still present. Okay, so we need to calm the patient, we need to calm down the patient, we need to reassure them, and we need to see whether those symptoms are still present. Okay, reassure patient about heart rate. So, the patient would be anxiously asking you, anxiously questioning you about his condition. So, we need to reassure that the heart rate is normal because the patient is under ECG monitoring. Find out if the patient is taking for medication for anxiety. Okay. So, the patient would be complaining of something and it has been revealed from his or her clinical records like the patient was on medications for anxiety. We need to question that. Okay. Give information about citalopram. So, during our inquiry, the patient would be giving you more comments on citalopram. We need to talk more about citalopram. Okay. So, there is some sort of information is given there. Yes, so we need to inform more about citalopram. The patient would be giving you some information on medication that he or she has been taking. So, we need to inform the patient. The patient would have stopped this because of some reasons. We need to explore that, and you have to inform more about citalopram. It is given like SSRI, selective serotonin reuptake inhibitor. So, this information, it is not a must to exhibit that. Okay, SSRI, selective Mr. Martin, this is selective serotonin reuptake inhibitor, because the patient would not be able to follow that. So, it is fair to avoid that. Okay, there is no problem, you will not be getting any penalization for this avoiding that, because it is very hard for a normal patient to follow, common folk to follow. So, avoid that. You can just give a brief description. Without that term, you can give an you can just explain that medication. It is not it is not a must to use that SSRI, selective serotonin reuptake inhibitor, because it is quite very hard for a normal person to follow that. So, it is better to avoid that. There won't be any problem for you. Okay, you can do that, my dear students. Yes, advise patient to speak GP about medication if concerned. In case if the patient is concerned about the medication, we can ask the patient to have a consultation with the GP or to have a talk with the GP. Okay. Explore any other treatment options tried. We can ask them whether they have tried any other treatment options, because it is given like relaxation counseling techniques. Okay. Offer to give patient information leaflet or website recommendations for relaxation techniques. Finally, we can end up the conversation by offering more information, website, leaflet and all we could offer for the patient to pursue relaxation or counseling. Okay, so that is what the topic is. Hope the question is clear to one and all my dear students. Is the question clear? Is the question clear to all? Yes? Yes, my dear students, the question is clear? Okay. So, there are certain things that you need to focus on this question. Do you know what is that? Do you know what is that? Yes? So, how can we start this introduction? You just tell me. How can we start this introduction? What is that thing that we need to focus in this question? Okay, what is that we need to focus on this question? You just tell me that. Yes, students? Yes, how we can start this? You have to take a great care when it comes to the introduction, because you cannot just say like good afternoon, good evening and all, because it is clearly given in the question like the patient is here for overnight monitoring. Now the night is over, we need to start the conversation. It is given like we need to find out whether the patient had a comfortable night. Okay, we need to ask whether the patient had a comfortable night. That means regarding inquiry on sleep, we need to start. So, overnight monitoring sleep. So, we need to start the topic by using good morning, because the time indication is given in an indirect way. In a hidden format, it is given like good morning. Okay. So, overnight monitoring is over. We need to start the conversation by asking wellness of this, by questioning the wellness of their sleep. Okay. So, you need to start by good morning. All of you should have a focus on that. These sort of hidden indications will be given that they are seeing whether you are appraising the questions carefully. So, make sure that you people are noticing all those things. Just start this topic with a good morning, because overnight monitoring regarding sleep, we are asking their well-being or wellness of sleep. We are starting the conversation. So, make sure that you are starting this conversation with a good morning. Okay. Be back onto screen. We can remove the question. Okay. So, we will go for our discussion. I hope all are ready. So, we need to start the topic with a good morning. The topic, okay, we need to start the conversation with a good morning. Yes, shall we start? All are ready to listen? Yes, my dear students, all are ready? Yes. So, how we can start the conversation? Good morning. So, the name is known to us, the case is a known case, we have already collected their name. Okay, good morning, let the patient's name be Martin. We can call them as Martin. Every day I am calling the patient as the routine traditional name is Martin. Every day I am using that. Okay. It has become a custom that we are using the same name. Okay. Good morning, Mr. Martin. Good morning, Mr. Martin. I am your nurse here. Okay. Okay. Good morning, Mr. Martin. I am your nurse here today. Okay. I am here to see how you are feeling. I am here. Hi, Raji. Hello, Mane. Good evening. Yes. Okay. Good morning, Mr. Martin, because the time indication is morning. It is given in an indirect way. So, the time is morning. We are having the conversation with the patient during the morning time. Okay. Good morning, Mr. Martin. I am your nurse here today. I am here to see how you are feeling. Okay, hope you had a comfortable night. Hope you had a comfortable night. How was your sleep? Hope you had a comfortable night. How was your sleep? Okay, so this is what the introduction we can give to the patient. Good morning, Mr. Martin. I'm your nurse here today. I'm here to see how you're feeling. Hope you had a comfortable night. How was your sleep? So, this is the starting sentences. Okay, these are the starting sentences that you can crack for this question. So, the patient would be responding like, nurse, everything is okay, but I am quite disappointed at you. Okay, so this is not my usual time for waking up. So, you have just, okay, I am very angry for being woken up very early, nurse. This is not my usual time, okay, for me to come out of bed. This is not my usual time. So, I am really angry for being woken up early in this morning, nurse. Though the patient is saying like that. Okay. So, what you can say, I am sorry. I am sorry, excuse me for inconvenience. Okay, I am sorry, or excuse me for inconvenience. I understand. Well, Mr. Martin, it is our hospital policy, it is our hospital procedure. Okay, it is our hospital policy, it is our hospital procedure. Okay, to start the daily checks, okay, clinical observations early in the morning. Okay, we need to, it is a must to finish clinical observation before ward rounds. I'm sorry, excuse me for inconvenience. Either of this you can use. I'm sorry, Mr. Martin, excuse me for inconvenience. I understand, but it is our hospital procedure. It is our hospital policy to start clinical observations by early morning. It is a must to finish clinical observation before ward rounds. It is a must to finish clinical observation before ward round. See, we need to monitor your blood pressure, temperature, oxygen levels, okay, so that we can report it to the doctor at the time of rounds, okay, so that they can do the needful. The doctors could appraise your health situation and could do the needful. Doctors could appraise your situation and could do the needful. So, please cooperate with us, kindly cooperate with us, or please join your hands with us. Okay. So, this is how it is a must to finish clinical observation before ward rounds. We need to monitor your temperature, blood pressure and oxygen and have to report it to the doctors. Okay, it is a must to report to the doctors at the time of ward round, so that we can report it to the doctors at the time of ward rounds. Okay, they could appraise your health situation and will do the needful. Okay, they could plan further treatment regime according to your situation. Okay, so please join your hands with us. Yes, okay, kindly cooperate with us. Please join your hands with us. The patient will be saying like, yes, nurse, I understand. Well, how are you feeling now? Are those symptoms still present? Well, how are you feeling now? Are those symptoms still present? I mean chest pain and dizziness. So, we are questioning the patient. It is given like, are those, well, how are you feeling now? Are those symptoms still present? Hope you are feeling bit better. Hope you are feeling better. Are those symptoms still present? I mean chest pain and dizziness. So, the patient will be saying like, yes, nurse, I am feeling better, but I feel like my heart is pounding, my heart is racing. That is what I feel, quite anxious. My heart is racing or pounding. Okay, that is what I feel like. Rest everything is there. So, we can say like, I am very glad to hear that your symptoms are relieved. Okay, okay, I am very happy to hear that those symptoms are no more. Your recovery is great. So, you can appreciate and boost the confidence of the patient. It's glad to hear that, Mr. Martin, your symptoms are relieved. Okay, those symptoms are, your recovery is great. You can say like that. Glad to hear that, Martin. Yes, your symptoms are relieved. Glad to hear that your symptoms are relieved. Hope you are okay. Glad to hear that you are comfortable. Your symptoms are relieved. Okay, your recovery is great. Okay, likewise, you can boost the confidence. You can make the patient more confident. Fine. Yes, and you do not have to worry about your heart rate and all. See, you are under ECG monitoring. You do not have to worry. Okay, you do not have to worry. See, you are still under ECG monitoring. Your heart rate is normal. Okay, all those readings are perfect, and you know all other tests were proven to be very, all those tests were negative. All those tests were showing a normal results. You don't have to worry. Don't worry about your heart rate. You are still under ECG monitoring. See, you are still under ECG monitoring. See, you are still under ECG monitoring. The heart rate is normal. All other parameters, all other readings are perfectly all right. There is no evidence of any clinical anomalies. Okay, there is no evidence of any clinical anomalies. Okay, there is no evidence of any complications or any other problems. Okay, stay confident, you are all right. Stay confident, you are all right. Yes. Okay. Okay, so that is how we have to boost the confidence of the patient. I hope my, hi Beena, Mekhraj, hello, good evening Mane. So now I am noticing your wishes and all. Hope these questions are clear, hope this you are clear so far. Yes, my dear students. So we are just assuring the patient regarding the, you do not have to worry. See, all your ECG readings are normal, there is no evidence of any clinical problems or anomalies. You are perfectly all right, your heart rate is normal, all those parameters are normal, do not have to worry. Stay confident, you are all right. Okay, so the patient will be saying like, oh nurse, thank you nurse. So they have already reported their complaints like pounding and a rate. Well, Mr. Martin, Mr. Martin, I have come to know that you are taking medications for anxiety. Well, Mr. Martin, I have come to know that you are taking medications for anxiety. Am I correct? Is that true? Is that true? Am I correct? Okay, well, Mr. Martin, I have come to know that you are taking medications for anxiety. Is that correct? Or am I correct? You can ask like that. So patient will be saying like, yes, nurse, I was on medication. Okay, tell me, are you still continuing those medicines? Okay, tell me, can you just brief me more about your medications? Can you brief me more about your medications, or can you tell me more about your medications? Can you give me more details on your medication? Okay. Okay. Can you tell me the medication? Okay, can you tell me more about your medications? Okay, what was the medicine that you were taking? Okay, are you still continuing that? So the patient will be saying like, nurse, I was on citalopram, but I have stopped taking it a fortnight ago. Okay, so I was on citalopram, nurse. I'm not taking those medications now. Well, what happened? Well, what happened? Why do you cease those medications? Okay, why do you stop taking those medications? Why do you cease taking those medications? Okay, did the doctor ask you? Did the doctor ask you? Okay, so the patient will be saying like, no nurse, no one has asked me, but I have come to know that this citalopram is used in anxiety as well as depression. See, I don't have any problem with depression, then why should I go for this? The patient would be questioning you. Okay, so എനിക്ക് സിറ്റാലപ്രം ആയിരുന്നു, ഞാൻ കേട്ട് ഡോക്ടറൊന്നും പറഞ്ഞിട്ടില്ല, ഞാൻ കേട്ടിട്ടുണ്ട് ആൻസൈറ്റിയും ഡിപ്രഷൻ ഇത് ഉപയോഗിക്കുന്നത്, എനിക്ക് ഡിപ്രഷൻ ഒന്നുമില്ല, ഐ ഡോണ്ട് ഹാവ് എനി കംപ്ലയിൻസ് ഓഫ് ഡിപ്രഷൻ, ഐ ഡോണ്ട് ഹാവ് എനി ഇൻസിഡൻസസ് ഓർ ഹിസ്റ്ററി ഓഫ് ഡിപ്രഷൻ, then why should I go for this? ഞാൻ എന്തിനാ പിന്നെ ഈ മെഡിക്കേഷൻ? So I've just stopped this. Okay, I value your says, I understand, or I value your says, you are right. Okay, but you should know more about citalopram. Okay, I value your says. Okay, you are true, you are correct. I value your says, you are correct, you are true. Citalopram, but you should know more about citalopram. Okay, it is used in both cases. See, purposefully I am avoiding that SSRI because it is not fair to use this complicated name because it is very difficult for a normal person to follow. So I am just ignoring that and discontinuing. I value your says, yes, you are right, correct. Citalopram, but you should, okay, citalopram is a medication which is used in both cases, but you should know more about citalopram. Okay, but you should know more about citalopram. It is used in both cases. It is used in anxiety as well as depression. Okay, many people of your situation have taken. Okay, many people of your situation have taken it. They all are doing well. Okay, they all are doing well. Okay, they all are doing well. Okay. Yes, but it is a must to go for regular intake, but it is very necessary to go for a regular intake. Okay, but it is a very must. Okay, it is very necessary to go for a regular intake. Okay, you shouldn't stop it in midst. Okay, a continuous course is very necessary. You shouldn't stop that in midst. Okay, a continuous intake for 4 to 6 weeks. A continuous intake. Okay, a continuous intake for a minimum 4 to 6 weeks are very necessary to to be effective. Okay, a course of minimum 4 to 6 weeks. Okay, it is very necessary for to be it is very necessary to be effective. It is very necessary to take these medications for 4 to 6 weeks to be effective. Okay, it will be giving a desired outcome only if it is taken for a 4 to 6 weeks. Okay, only if it is taken for 4 to 6 weeks. Okay, if this medication have to be effective, you have to take this medication for a 4 to 6 weeks. Okay. Yes. Okay. Okay. continuous intake for 4 to 6 weeks is very necessary to be effective. A continuous intake for 4 to 6 weeks are very necessary to be effective. Okay, then only it will be producing a desired outcome. Then only you can expect a desired outcome. Okay, that is how you should convince the patient. Yes, yes. So that is what. Now I strongly request you to go for self-diagnosis and self-treatment like this. Okay, it can cause health problems, it can cause other complications, it can cause serious health problems. Now I strongly, this is what about citalopram, this is all about citalopram. Okay, it has to be taken for 4 to 6 weeks to be effective, it has to be taken for 4 to 6 weeks to be effective. Now I strongly request you to go for self-diagnosis and treatment like this. You have to consult a doctor for treatment. Okay, never go for self-diagnosis and treatment. It can cause serious health problems. Okay, I strongly request you not to go for self-diagnosis and self-treatment. It can cause serious health problems. Are you getting me, Martin? So now if you have got any concerns with the medicine, you can definitely consult a doctor. I could fix an appointment with the doctor. You can have a discussion with him. Okay, if you have got any concerns with the doctor, now okay, you can have an appointment with the doctor, you can have a consultation with the doctor. Okay. Here, okay, the doctor will let you know more about it. Okay. Vinod, your voice and expressions are wonderful, sir. We love to hear your speaking session. Thank you for this compliment, Manklai. I am very happy. Okay. Very happy to receive all this sort of appreciation from my students. So happy, God bless you all. Okay, and you can give a critical appraisal also. If you want me to improve in some ways means, you can definitely contribute that too, so that it will be a sort of evaluation for me too. I could improvise in some way means, you can just give me some critical appraisal too. Okay, thank you. Yes, so that is what we have discussed so far. Okay, Mr. Martin, tell me whether you have tried any other treatment options. Tell me whether you have tried any other treatment. Have you tried any other treatment options like relaxation techniques or counseling? Okay, have you tried any other treatment options like relaxation techniques or counseling, Mr. Martin? Along with these medications, have you tried any other remedials or treatment options like relaxation techniques or counseling? Martin. So they will be saying like, see, I have heard of it, nurse, but I don't have any idea. Can you please tell me more about this? Okay. See, Mr. Martin, relaxation techniques, okay, and counseling are proven to be very effective. Okay. It has been used in clinical practice for many years. See, okay, see, Mr. Martin, I will surely explain you more about it. See, relaxation techniques and counseling have been in use for clinical practice, okay, have been used in clinical practice for many years. These are proven to be very effective. Okay, these are proven to be very effective. When it comes to relaxation measures, you can go for yoga, meditation, repetitive prayers, okay, and so on. Okay, you can go for yoga, meditation, repetitive prayers, and so on. Okay, if you want to go for counseling, if you want to go for counseling, you can consult your doctor and can take that option. If you want to go for counseling, you can take an advice from your doctor and can take that option. Okay, you can consult with your doctor and can take that option. Okay, these are proven to be really very effective. Okay, I am sure that this will do a great help. I am sure that this will do a great help. Okay, so if you want to take counseling, you can consult your doctor and can choose that option. Okay. Yes, this will do a great help. Okay, I am sure that this all will do a great help. Try this. Okay. So the patient will be saying like, sure nurse, I'll consult my doctor and I will definitely go for that. Okay. See, I've got some websites and leaflets, brochures, leaflets and websites regarding relaxation techniques. I'll give you that. Okay. So that will surely help you a lot. Okay, that will do a great help. Okay, if you want means, or if you are okay means, if you are ready means, I'll get you more information, leaflets and brochures. I've got certain websites and leaflets regarding recommendations for relaxation techniques. I'll give you that. You can make use of it. Okay, that will do a great help. How does that sound? How does that sound? So, the patient will be saying like, yes nurse, I am ready, please give me that. Surely I will get you those brochures and I will offer you some websites so that you can go through that and can make use of it. You can go through that and can make use of it. Okay. It will definitely contribute a lot in your treatment and recovery process. Okay. It will surely help you a lot in your recovery process. Okay. Okay. You will have a fast and speedy recovery from your present complaints. Okay. Be having a fast and speedy recovery from your present complaints. Okay. That will do a great help. How does that sound? Sure nurse, please help me. Okay. So, do you have anything else to ask me? Do you have any more queries for me, or do you have any other questions for me? Is there anything else that you would like to ask or discuss? Whatever it is, that is summarizing we are asking. Okay. Is it clear? Have I made everything clear? Are you okay? Do you want me to explain something more? Do you have any questions for me? Any other queries? But what I'm known as, I feel like more informed. It's very clear. Okay, Mr. Martin, then shall I proceed with my daily checks? Okay. Okay, Mr. Martin, then shall I proceed with my daily checks? Okay, we are asking the patient like, then shall I proceed with my daily checks? Okay, okay, then shall I proceed with my daily checks? Martin, are you ready? Okay, so they will be saying like, okay, nurse, you can continue. Now you feel relaxed. Okay, now you feel comfortable. Now you please relax, feel comfortable. Let me start. Okay, now you please relax, feel comfortable. Okay, you can lie on this cot, feel comfortable, feel relaxed. Now you relax, feel comfortable. Let me start. Now you relax, feel comfortable, let me start. Okay, I will finish it soon. Okay, I will start the whatever it is. You can just end up the conversation by saying, okay, okay, then shall I proceed with my daily checks? They will be agreeing. Oh, nurse, please continue. Okay, thank you. Okay, thank you, Martin. Now you relax, feel comfortable, let me start. That's it. By that, we are giving a conclusion to our statement. Okay, we have come to a conclusion. Now we have come to a conclusion of our speaking. Okay, this is how we are. Overall construction of the speaking session goes like this. Hope everything is clear, all my dear students. Anything else you want me to discuss? Hope the session is clear to one and all. Yes? Is that clear, all of you, my dear students? If you are giving me a thumbs up, or if you are giving me a comment like okay, that I will go for, I will wind up the session of today. Yes? It's okay? How was the session? Hope you have really enjoyed that. So, please do listen this. Okay, you can like it, comment it and share it among your friends, those who are in need. Okay, make use of these sessions. Okay, and now I would like to really thank to my dear colleagues, my dear Jobin and my dear Joyson, and again my guy and my dear Roshan. Okay, my Joyson is there, my Roshan is there, and my, see, I just, the span of time, I just forgot his name. I'm sorry, Roshan. So, I've got my full gang here. Roshan is there, my Joyson is there, and Jobin is there. Thank you all, my dears, for making this session possible. Actually, it is because of them this session is possible. I'm just giving you lectures. Okay, the technical support and all this session is, and their session is being carried out by them. I'm very happy with them. So, all my dear students, thank you for your valuable comments and thank you for your cooperation. Okay, so it's because of you we people are still here. Okay, so make use of these classes and learn and move to your dream destinations, cracking OET. I wish you all the best. So, see you next Tuesday with another interesting session. Till then, take care all of you. Bye. God bless you all.